Hello, today I wanted to make a viewer requested video, and someone had requested that I make a video about plugged ducts. So thought I would share a little bit about plugged ducts, and what is the causes and the symptoms, and what I do as my treatment for them, and stuff like that. So let's get started. Okay, so a plugged duct is just an obstruction of flow from milk through the breast. So that can be farther back in the ducts, or that can be actually in the nipple pore. So sometimes it's caused by skip feeds or infrequent feedings. Sometimes it's because of engorgement, and sometimes it's pressure on the duct from an ill-fitting bra or a diaper bag strap. Sometimes it's just from inflammation. So what will you feel when you have a plugged duct? One of the first things that you'll probably notice is pain. And sometimes it's just tenderness, or it can be a constant dull pain. You'll feel probably a lump, and it might be wedge-like, where it's like pointing towards the nipple, kind of gets larger as it goes back. There might be redness there. It's probably tender. It might be swollen and kind of hot to the touch. It probably will hurt. It'll be more painful before you feed, and then a little bit less afterwards, but the pain will still be there. You might have a fever, but it'll be fairly low, like a low-grade fever. So what you want to do, and what I do, is you don't want to stop nursing. They used to think that that was the best option, was to just cease feeding, because they thought, well, then you have an infection in the milk and it's bad for the baby. That's not true at all. So you want to actually nurse as much as possible. You want that side to stay as empty as possible. So you want to either be nursing or pumping or expressing every 2 hours at least. Keep it as empty as possible without neglecting the other side. That's the unaffected side. So you want to keep that empty, and you want to make sure that you don't neglect the other breast. Feed off of the affected breast first. So the initial latch on, when your baby first shows signs of hunger, have them feed off of that breast first, and then continue on the other side if it's the other side's turn, or so on. Before you start nursing, apply heat. This can be like a moist, warm compress. And so you want to massage towards the nipple. You can do circular motions or just straight down, just like a firm but not too hard massage towards your nipple in the affected area. And you can take a hot shower and get a wide tooth comb and run it through soap, and massage with that towards your nipple. That helps draw it down also. Or you can do a basin soak, where you get a basin of hot water and maybe even Epsom salts, or something of that nature, and make sure it's hot water, and you lean over the basin and dip your breast into it and let it sit in that water. And then massage it while you're doing that breast compressions, and try to get it out that way. And then while nursing, you want to do the compressions, where you're helping the milk flow towards the nipple, help it massage it down. And you can try, some people say that you want the chin pointing to where the blockage is. You can also try dangle nursing, which is where you lean over the baby and kind of dangle your breast into the baby's mouth, and that might help the milk flow through all the ducts easier. Let me see what else. Okay, and then after you finish the feeding and completely emptying out the breast, you want to, pump if there's anything else, just to make sure, or hand express to make sure that everything is completely out of that breast. Cold compresses between feedings is a really good idea, because you want to do that hot, cold. Heat before and cold afterwards. The cold will reduce inflammation and help with pain. You can also take anti-inflammatories for the pain. what you want to watch out for with plugged ducts, and I've had this before, is mastitis. Mastitis is when you develop a infection in the breast tissue around where the duct is plugged, because that fluid buildup causes your tissues in your breast to become very irritated, and it causes an infection. If you have a high fever, flu-like symptoms like chills and body aches, and you just generally feel really unwell, you might be experiencing this breast infection, mastitis. So what you want to do is call a professional. Call a lactation consultant, go to a breastfeeding clinic, call a doctor, and if all else fails, if your fever is high enough, go to the emergency room. So with that, that's wow, that went by. I said all that very fast, but I've had problems with plug ducts the past couple months. I would say about the last 6 months. My son is 17 months old now, and I'm not sure. I think after a while, I thought at first it was ill-fitting clothing, putting pressure on the duct, and then I thought maybe he's not emptying them out well. And after following all these steps, I still have the problem. And so some women have a problem of recurrent plug ducts, and they think that it might be due to fatty buildup in your milk being high. And so there are some things that you can take, some different supplements that you can look up that, or ask your doctor or lactation consultant that you can take that are safe for breastfeeding that can help with that. One of those is evening primrose oil, and I'm actually going to start taking that to try to help with that. And it's a benefit that it helps with trying to conceive, since we are going to be doing, or are doing that, kind of hoping for a baby soon. So yeah, so it kind of, I assume that it's because it thins it out and helps the milk flow easier. So and so I think there's some other things that you can do also. But yeah, that's pretty much about plug ducts. If anyone wants to know any more about my experience with mastitis or anything else about mastitis, I can make a separate video about that. But I just wanted to tell you all about what plug ducts are, what to do if they happen. You can prevent mastitis from occurring from them. Mastitis can occur on its own just from being tired and run down and such, but most of the time it's caused by plug ducts that aren't released, that aren't taken care of. So you want to really, get this problem. If you have a plug duct, get it taken care of as soon as you can, because you don't want to deal with that. So yeah, and that is all. That's all. I just wanted to share that with you. Okay, so comment and subscribe and tell everyone you know about Breastfeeding Mamas, and have a good day. Bye.